Today. Thanks so much for joining me for this pre-event podcast. I wanted to jump on here and tell you a little bit about an upcoming event that we have going on called our Joint Health Event on September 26th and 27th. And I'd love for you to come hang out with me and some dear friends of mine who are going to be talking about how to keep your joints healthy while living with a bleeding disorder. Super important topic that's near and dear to my heart. And I know that many of you who are listening to this today are feeling the same way, that there's still a lot to be done in the effort of protecting our joints while living with a rare disease or a bleeding disorder or chronic illness that specifically attacks your joints. So I'm super excited about the lineup. We have some amazing sessions that we're going to be talking about, some really critical targets that I think are really, really important. We're going to be talking about imagining a future without joint disease. I think that's possible actually in this day and age. So I'm super excited to talk about that. We're going to be talking about arthritis and where blood should be and shouldn't be with Kevin Griggs. That's going to be a great session. Talking about some pain relief issues that I think are important. Talking about mental health as it pertains to pain management, but also about diet and exercise and your thought life and trying to stay mentally and physically healthy and well. That's going to be really exciting. We're talking about living without boundaries, talking about what the great aspects are of having protection preventatively are. And so really excited about that. But today I have invited a special guest to join me who's going to be talking about prophylaxis as a part of this joint health conference. Super excited about that. And I have Marjorie Hunt joining me today. And Marjorie, I know you're on the line, but it is great to see you. Thanks so much for joining me for this pre-event podcast.
Yeah, thank you for having me here.
Well, I am super excited about this conference coming up. I know you're going to be doing a session specifically really hitting the heart of the issue, and that's about preventative treatment to prevent joint damage from ever occurring in the first place as it pertains to prophylaxis. And that session is going to be on September 27th at 2:15 Central Standard Time. So wherever folks are watching from or tuning in to, make sure you know it's Central Time. But I'm really excited about this session because this is really a key premise behind a lot of what we're talking about as it pertains to how do you keep your joints healthy is really not letting it become a problem in the first place, right?
Yeah, exactly. That's kind of hopefully what I'm going to present on. Hopefully the kind of take home message for everybody is I think most people kind of know what prophy is, but we'll kind of go through that, a little history of it, but then really hit hard on why does it matter? Why does it matter to you as a patient? Why does it matter to you as a caregiver? As far as hopefully what problems you can maybe prevent down the line by taking care of these joints now.
Yeah, and I think that that's something that is still amazes me that so many people still, they might say, yeah, I'm on a prophy regimen, but they don't really adhere to that. Sometimes the adherence portion is just as much of a problem. And I talk to guys all the time that are still going, yeah, I'm kind of on demand. I don't really infuse unless I have a problem. But that can be really detrimental in the long run. And really once it's happened and you have joint damage, it can be too late. We've found sometimes that just one major bleed can cause a disruption in the joint space, right?
Yeah, absolutely. And I think, unfortunately, people are kind of aware of the problem they have right now, as far as pain, those bleeds, et cetera. But compacting over the years and what that looks like as far as are we looking at joint fusions? Are we looking at joint replacements? If you do need a joint replacement, what does that look like? What are the risks involved with that? If you can't have an active lifestyle when you're in your 40s, 50s, et cetera, what does that lead to with other, disease states like high blood pressure, diabetes, or your mental health, not being able to get out and exercise and enjoy walks? So just trying to look at the big picture. And, they always say hindsight's 2020, but hopefully trying to shed a little bit of that light now so that, in 20 years, you're in a good place, as opposed to wishing maybe that somebody had told you that these problems could occur if you didn't take care of your joints now.
Yeah, I find that this is something that's really interesting. We're seeing a lot of with women with bleeding disorders and even some of the mild patients that are getting diagnosed now. We're starting to understand that you've got people at 35, 40 years old having to have a knee replacement that really could have been avoided had they been on some sort of preventative treatment regimen. And again, once it's too late, it's too late. You can't go backwards and redo that. But if you stay on a prophylactic treatment regimen, that consistency really is everything, right?
Yeah, yep, absolutely. You're right.
Yeah,
So, I'm excited for the talk.
Yeah, that's
Yeah.
exciting too. I'm thankful that you're going to be doing it, and you have a background in pharmacy. I know a lot of people might have seen you present at other meetings, and of course you're doing a lot of presenting now with Octapharma. So we're super thankful for their partnership and your partnership. But tell us a little bit about your background as being a part of in pharmacy and helping patients stay on their treatment regimen with adherence. Has that been a great journey for you? And what are you excited about as far as the future goes with that?
Yeah. So just a little bit about me and where I come from. So I both parents actually are pharmacists, and we owned a small town pharmacy when I was a kid growing up. So I was literally raised in a pharmacy, playpen and all, and in between, back in the back there. And as soon as I was old enough to look over the counter, I mean, things were a lot different, 30 years ago, but I was up there helping. And so, I mean, I think that instilled that sense of community, firsthand seeing what it is to help somebody. And again, since my parents owned the pharmacy, like if it's a night, it's a weekend, a kid needed an antibiotic. I mean, it wasn't a specialty pharmacy, it was more of a community pharmacy, but still, somebody had surgery, needed pain medicine. We came in on the nights, weekends, etc. And so I think that's kind of where it started for me. Since graduating pharmacy school, I've worked in both a community setting and then the specialty pharmacy, and that's kind of where my bleeding disorder journey began. And so I'll be honest, I kind of stumbled upon it. Didn't really know what I was getting myself into, but I really liked it and started to kind of gravitate towards the bleeding disorder community and specifically those types of medications and helping those folks. My very well, they weren't my first patient. The first patient that really stuck in my head was an older gentleman. He was probably in his early 60s. His wife took care of all of his, factor and all the other meds for him. And I was talking to her. It was a Friday. We were waiting on a prior authorization. And I call her in a panic and I'm like, they can't get the auth to go through, but I want to make sure like he has enough medicine. Obviously, I don't want him to go without. And she goes, honey, are you new to hemophilia? And I said, I'm sitting here thinking, oh boy, is it that transparent? I've been working at this pharmacy a couple of months now. And I'm like, yes, ma'am, I am. And she said, well, let me tell you something. We like to hoard things. We have enough medicine to get us through the weekend. And I just laughed. And that was kind of my first true, like, into the community beyond just dispensing
Yeah.
medications, and it stuck with me. And it's been a great community. I've kind of stuck with bleeding disorders ever since and have continued to go down that path. So now with Octapharma, I'm a medical science liaison. So just kind of merging the two worlds of science and my passion for community and being able to kind of further my career has been a great privilege.
That's so wonderful. Well, we're thankful to have you. I know a lot of times I talk to guys about this a lot. I'm living with a bleeding disorder myself. I find that, my relationship with our pharmacists sometimes are more important. We talk to them more often than we do even our physicians sometimes. And so you really make a huge difference by being so knowledgeable and being in that space. But your perspective on this from an educational component and also from just the guidance that you provide at Octapharma is really critical. And we're really grateful that you're doing what you're doing and super excited to have you a part of this joint health conference. And I'm super excited about your session coming up on the 27th. I think it's going to be really insightful, but also really encouraging because there's still so many folks out there that are really fighting to stay consistent and also fighting to get the medications that they need in a timely manner. So thank you so much for being a part of this conference. Thank you for being willing to hang out with us for a little bit today, and look forward to seeing you very soon.
Yeah, of course. Thank you.
Awesome. Well, it is really exciting to be getting ready for this great event. Like I said, Marjorie's going to be giving us that presentation on the 27th at 2:15 Central Standard Time. You can go onto our website and register for this event. You have to get the registration accomplished in order to be able to get the links for this event. And it's just one registration for all the sessions, so you don't have to register for pick and choose each one. We'll send you all of them. But go to our website right now at hope-charities.org. You can register for the event. We're going to have a ton of fun in these sessions. We've got some giveaways that we're doing, giving gift cards, $25, $50. It's going to be a lot of fun in that way. And so we want you to be a part of it, but you got to register. So go make sure you do that on our website right now. You can register for that, or you can look down in the comments below and click the link and it'll take you straight there. But we're super excited to see you and have you join us for this live event. We're also going to be having a question and answer time for each one of these breakout sessions. So Marjorie will be there to be able to present, but also be able to answer any questions that you might have. have. So make certain that you join us for those live sessions because they're super important. Whether you're at work or school, or maybe you're on a break during work, maybe jump in to one of these sessions and pick out a great conversation to be had and meet some other hemophilia families that are living all around the country and other bleeding disorders to be a part of this conversation. So thanks so much for jumping in here and being a part of this pre-event podcast with me. Make sure you go register right now in the link below and get into the fun with us. So we'll hope to see you soon. And thanks so much.